Well, welcome everyone to another one of the Maryland Nursing Workforce Center presentations, focusing on the next generation NCLEX project and initiative. We've been meeting fairly regularly lately, and today we're going to talk about taking action in the classroom. And I'm going to share with you some of the activities that I have been adding to my classroom teaching sessions, as well as some ideas for other settings. So I teach in a didactic classroom, but as well as some other settings, learning environments. Today's reminders are that the participants are to be muted, please, and turn your cameras off for this virtual event. Please type your questions or comments in the chat box. Someone is monitoring that chat box. And after the session, please complete the evaluation that will be sent to you via email. And nurses can receive 1.5 contact hours for attending this activity and completing the evaluation. And you will receive the CE certificate via email from the University of Maryland School of Nursing within 2 to 4 weeks of submitting your completed evaluation. And the presenter, me, and the planning committee have no relevant financial relationships with ineligible companies to disclose. The purpose of today's presentation is to guide you through the process of enhancing your classroom teaching strategies to promote the development of clinical judgment. And the objectives of today include describing the concept of small teaching, creating a list of ways to engage in the classroom by making some small changes to promote clinical judgment, to begin to infuse clinical judgment terminology when you're designing your class discussions, presentations, and your lecture level objectives. And the last objective is to have you include one classroom strategy each week that will promote clinical judgment. I do have a few slides to share with you just to sort of remind us of the background information. I know if you're new to this, if this is the first session that you've attended in the series of sessions that have been presented since last fall, there are 9 presentations to date and more this spring scheduled. We have in our background sessions discussed the purpose of the changes to the NCLEX exam. We have discussed the development of case studies. We understand that each case study on the NCLEX exam will include 6 next generation question item types. And we understand that there is going to be some changes to the minimum and maximum number of items. You can see here a comparison of the test design that has been offered during in a winter 2022 newsletter on the National Council State Board of Nursing website. So you can visit that website if you are new to this topic and just beginning to engage in the topic. I would recommend that you read these newsletters that are available, kind of start at the beginning and work your way through them. This most recent newsletter included the current item types, also with some descriptors about each of the item types. For example, adding under extended multiple response, the various types of extended multiple response items. So please review that if you are new to the topic. Also, you will want to familiarize yourself, and what we're going to do today is try to familiarize our students with some of the language around this clinical judgment measurement model that was designed in the process of developing this new test, that the test that will, and we anticipate, begin to be administered after or during April of 2023. So we are targeting next May 2023's graduates to be seeing these types of items and these case studies. And certainly with students, I presented, as a matter of fact, I did a presentation today to our students for the very first time. I presented the clinical judgment measurement model in totality, focusing on the nursing process, which is language that they have already been exposed to and familiarized with. And then really honing in on this layer 3 of the clinical judgment model and the 6-step process that a nurse goes through to make decisions and make clinical decisions. So this is the area of my focus today and the focus with our students who will be taking this test. And, as a form of background and a little bit of a backdrop to today's presentation, I gave a presentation in September of 2021 that you find on the Maryland Nursing Workforce Center's listing of presentations. And it's kind of called First Steps of Infusing Next Generation NCLEX into the Classroom. So if, again, you have not seen that presentation, that does provide some first steps, analysis of your own use of active learning in your classroom, and a few examples of some new ways to present information into the classroom. So you may want to go ahead and look at that presentation as well, and that would supplement today's information. And so before we begin to get into the meat of the presentation today, just a reminder that if you have any questions, please place those questions into the chat box so that the person who's monitoring the chat box can alert me and I can answer your questions. All righty. So today's presentation really focuses on a number of objectives that I have had when thinking about this infusing next generation NCLEX into the classroom. And so this process for me began last fall when I began reading this book that I am kind of featuring as a framework to the way that I decided to configure activities into my classroom. So, there's a lot of thinking that we're all going through right now, and it's not only about how to use these next generation NCLEX items in the classroom, but it should also be about when to use them and what is the best placement and sort of what will make the most sense for our students and having a variety of outcomes. And so I was reading this book this fall, and I really recommend this book. It's a small book, it's a quick read. And this book provides the reader with a synthesis of scientific, what I would call evidence-based strategies, teaching strategies. And in this one book, this author, James Lang, has compiled these studies, the quotes from these readings, and really provides us with a rich and clear set of strategies to use in the classroom to energize and boost our students' understanding of the materials that we are teaching. And in this book, he is providing us with many really small and very quick activities that require really minimal preparation to employ in our classroom. So after reading this book in the fall and kind of thinking about how to synthesize some of these activities, and also kind of at the same time thinking about our needs to infuse the classroom with some of the next generation NCLEX learning activities, I kind of began in the fall to add some of these short and very quick activities. This spring, I added the additional objectives not only to promote learning and retention of didactic content, but to also have the objective of having an increased focus on clinical judgment in the ways that I teach, and to prepare my students to become more familiar with next generation NCLEX item types. In my examples that I will show you, I am enhancing the students' understanding of the layouts of these item types, maybe the cognitive approaches to some of these item types, just how to approach some of these more complex item types, and to practice some of the psychomotor skills that they are going to be required to use, drag and drop being one example, highlight being another. So skills that our students may to date have really not had much experience with. So when kind of thinking of all of these objectives over the winter break, how I might modify my teaching this spring to meet these new personal objectives of my own, I decided to use the framework from this book, which is what I'm going to use today, to describe ways to engage in my classroom and to achieve all of these objectives. So a little bit about the book. The book is organized in kind of 3 sets of information. The first set of information is sort of a set of skills around acquiring knowledge. And the second set is about understanding the information. So a set of skills or practices that students can use to understand information better and more deeply, I guess is a good way to describe it. And the third set of chapters involves inspiring students. And so this third set is really where I started in the fall, which was trying to engage in the classroom and adding inspiration. And that's really what September's presentation was all about. Each chapter of the book includes anecdotes from the author's teaching experiences, examples of research that support various strategies described. And each chapter ends with a summary of quick tips. And you could actually, open up that summary of quick tips in that chapter and adapt that to your class within a few minutes before class. That it's that simple. These strategies are very straightforward. And so the first set of chapters, and I've got a little bit of a chapter overview here for you. The first chapter is about retrieving information. And so these are activities that allow students to focus in on key facts, to practice remembering a skill, and a skill, that maybe they lost during COVID. So practicing remembering. I've had a number of students, and I wonder if you have too, who have told me that in the last 2 years, what they really learned how to do well was take good notes. And that because of the nature of open book testing, our students have really not been practicing remembering or retrieving knowledge. And so in the classroom, we can provide them with opportunities to remember. And under the ideas of under retrieving, ideas like opening up your class with a question from previous content. So helping them to retrieve the content from just 1 week ago, bringing it forward to this week. Also to have the student write down what they remember from the reading that they did for class. What was the key takeaway that they had from the reading that was required for your class. And then also at the end of your presentation, having a closing question, or having the students, again, we've all heard this term, reflect on their muddiest point. And you can also embed quizzes, and that requires them to retrieve information from previous classes that you have administered. The next chapter is doing and using strategies that require the student to predict. And these activities allow the students' brains to be activated, to be engaged. Making predictions increases your learner's ability to understand the material, retrieve it later. And some of the ideas about classroom teaching where we can have students make predictions is to, first of all, begin by providing your information in context. So, give a patient scenario, right? A little bit of a story. And I do a lot of storytelling in my class so that we can take this very dry didactic content that I teach and bring it to life. We can also ask the students to predict from what their current knowledge is to what's going to happen next. And this is a great way to kind of get the student really thinking, priming the pump about content. We can actually ask them at the very beginning of class to predict what the class content might be about based on their readings or based on what they know about the content. Might be surprised actually what some of our students know about the content that we are teaching. The third chapter talks about interleaving, and interleaving is a strategy that involves mixing up topics, mixing up teaching and learning strategies, spacing learning over time rather than blocking learning and practicing of information in a big block. Like today, I'm going to study one topic, making sure to bring forward information from previous classes to this current class. Sometimes we call that scaffolding. Well, scaffolding is really a strategy of leveling of information. Interleaving provides our students with a new way to look at the information that we have taught in a novel context. So sometimes telling a real clinical story or having a real clinical case study where multiple types of information are required. Students need to apply lab knowledge, vital sign knowledge, assessment knowledge. And of course, we have settings in education where we do this very well. And one of those settings would be simulation. So simulation is full of experiences where our students are practicing multiple types of knowledge and even maybe practicing psychomotor skills, right? Starting that IV pump, setting it up, administering the medication. But we don't tend to do that as well in the classroom. And even in the basic skills classroom. So thinking about how in the classroom, we can think about the topic of interleaving and mixing up the ways the students will learn and use the information that we have taught them. All of these strategies, have the outcome of enhancing long-term memory development over time. And so it's really important that our students understand, while some of these strategies like interleaving feel really hard to do, that this is where the benefit comes from, is the hard work of combining information together and in real life context to answer a question or a problem or describe a process. And that is very hard to do. The book's next section, which is called Understanding, has 3 chapters. The first chapter is connecting. And in connecting, the author's key takeaway is that for connections to be meaningful, that students have to form these connections, not the faculty, not the teacher. So it is our job to create an environment where our students can make these connections. rather than us just giving them the connections. So what are some classroom strategies that we use to make connections? Well, certainly concept maps have been around for a long, long time, and they serve their purpose. Another way to help students make connections is to have them write down a minute thesis, write down a description of a process, write down how one disease like hypertension affects another system like the renal system, which I just taught about this week. So the renal system is definitely in my mind. So having them making these connections actually, you have to provide time for that, of course. Yesterday in class, I also engaged the students' emotional kind of context by asking them to share stories of patients who they may have taken care of. And yesterday's topic included chronic end-stage renal disease. So I felt that I had the time in class yesterday. And so I had about 40 minutes in class remaining to talk about end-stage renal disease. And I thought, well, I don't think I need all of that time. I teach pathopharmacology, so not the nursing care part. That's a different class in my program. So I asked the students to reflect a little bit on the patients that they had cared for. And I asked if they would be willing to share some clinical experiences about patients that they had cared for who had end-stage renal disease, just to set the stage for my conversation that was to follow. So this was before my content was delivered. And I will tell you, I think it really, I had 3 or 4 students who shared information, one who had gone to dialysis, one who had experienced a patient who had had a renal transplant. I think that sharing this information before the presentation rather than after kind of set a few of those goals earlier, right? It allowed the student to have a real clinical context. It allowed them to imagine where I was going to be going with the content, predicting almost in a way of what I might talk about. And it really enhanced then the description of the content that I shared. I was actually able to reflect and connect to those 4 stories that those students in my class provided. So I think that I tried to work really hard to create that environment to facilitate students making those connections. The next chapter talks about practicing. And so the key to this chapter is that the students need to be practicing what it is that we will be doing to assess for a grade, number 1, and that they need to practice in class. So for example, if we're going to be delivering exams in our course to measure what our students have learned in our classrooms, then we need to allow them to practice answering questions. And this could be done in a variety of ways. Certainly sample test questions in class. I'll be sharing some examples of what I've been using. As well as allowing the students to reflect on what they have learned. Writing, if you have a writing requirement in your course, that you provide a writing sample so that the students can see the depth of what it is that you are requiring and that you are grading them on. Allowing them, if short answer questions are on your exams or assignments, allowing them to generate answers to questions that are in that format. Very important for students to practice what it is and that you will be doing to evaluate their learning. And lastly, the last chapter that we're going to focus on this book is called Self-Explaining. And this is a chapter that talks about ways for our students to monitor their comprehension gaps. So how do they especially when studying alone. We know that students who study alone are not in touch really well with their own learning gaps, right? So we our students overestimate what they know. And so having strategies in class that allow them to paraphrase, to teach each other, to think out loud, are all ways for our students who may be otherwise isolated outside of the classroom to practice this self-explaining process. And so I always think about the advice that I give to my students, which is to find a study partner, to do some role playing. One is the nurse, one is the patient, practice administering the medications and what you need to know and say to the patient. But I think about how many of our students are truly studying in isolation by themselves. So we really must provide opportunities in the classroom for our students to think, pair, share together. We also did one of those activities yesterday, and it was quite satisfying to see students who I know I've met with talking with their classmates and their peers who I know otherwise study alone. So providing those opportunities in class, just is a good practice, because as we know, many of our students are in isolation. And so this really has been a process for me of trying to understand how I am going to use the concepts that are described in this book and achieve the outcome of using teaching strategies that engage and excite my students and help them develop long-term memories, while also having the outcomes and desired outcomes of teaching with an increased focus on clinical judgment and to increase our students' familiarity with next generation item types. So we have all of these goals when we're teaching in the classroom these days. We have lots of goals, and teaching them to be familiar with these items, as well as the language, some of the terminology that we are using around NGN. So here in this section of the presentation, I'm going to present to you some of the ideas and ways that I have attempted to begin to achieve these goals. And I hope that some of these ideas will inspire and motivate you, and maybe encourage you to change your weekly presentations and other learning activities. So I have some examples for classroom as well as learning activities. And so the first thing I did in January was this framework is what we have in our learning management system. We use Blackboard. And so we have weekly lecture objectives, and the weekly lecture objectives are very topically oriented, and I actually did not include them in this table because it was just too much. But what I did include was what was sort of novel about what we do, what I do in my weekly table of what it is I'm going to be teaching about that week, actually. So this first column helps the student to understand how to apply the lecture level objectives to their study practices. So I give the students tangible information about how to actually study, what it is that I want them to do. I want them to create connections. I want them to differentiate between things. I want them to understand pharmacological principles. As I said, I teach pathopharm. And in the next column, I place the lecture topics that are kind of in alignment with that learning activity. And so this was the standard. These first two columns are provided and have been provided to my students. So in January, I decided to add a column adjacent to this that kind of incorporated the clinical judgment considerations and as appropriate. So recognizing cues, analyzing cues. So the first first 3 steps here in prioritizing hypotheses relate to the pathophysiology content. And so in my orientation to the course, I shared with the student not only the clinical judgment model, but also how each week they will be tested. I will be measuring their ability to analyze cues, signs, and symptoms. And I will be measuring their ability to prioritize hypotheses. And in the pharmacological outcomes and objectives, I aligned all 6 steps of the clinical judgment action model, layer 3. So this was one attempt to familiarize my students with the language and the terminology, and also included a picture of the clinical judgment model with that layer 3 circled. So this was done in January, and each weekly lecture level objective was placed in tandem with an appropriate action from the layer 3. Another example was how I placed this at the beginning of a presentation to allow the students to practice retrieving information. This was an opening question from content from the previous week, and it allowed them then, I kind of gave it a name that they would recognize, chronic neuro recap, so that they could know that, okay, this is information from last week, and Dr. Martin wants us to recall this information. In this framework here, just to let you know, this is a Slido slide. Slido is a presentation software package that we have available to us. I'll talk a little bit more about audience response technology, but this is what we have and we are encouraged to use. The other outcome of this question was that it is formatted exactly as it is in the next generation NCLEX item type. So it is formatted. The nurse assesses the following symptoms: tremors, rigidity, slowness of movement, and unsteady gait. What condition is the client most likely experiencing? So I'm using the exact words that are found in one of the NGN item types, which we'll be seeing next. So this one activity engages in the student retrieving previous knowledge, and it also allowed them to hear and read the language of an NGN item type. And then that item was followed by this slide. So this is the actual slide that I had in my class. And this allowed the students the opportunity to see information from one of the Next Generation NCLEX newsletters about the bow tie type item. The reason I started with the bow tie, I feel like structurally this item is quite complex. And I thought, I really want to begin by demystifying this particular item type, because structurally, if I was a novice and I was a student looking at this, there's a lot to interpret here. So I showed the previous slide. The students answered the response using the Slido on their phone app. And then this slide followed. So it shows that this would be a slide, this would be an item type that you would see after the minimum number of questions. So this is going to be later on the NCLEX. And then I give them some considerations about how to approach this item. I read through the case with the students, highlighting that there are 2 tabs, meaning that there might be information to read on both tabs. I read through the question, which is, framed exactly, it's right from the National Council's newsletter here. And then I gave them an approach, so a cognitive approach to answer this question, and allowing them to kind of see how this would be dragged up. Step 1, attack the middle. Step 2, attack the left. And step 3, answer the right. And so students really liked seeing how to approach this item. And then we just continued on with the class. So it didn't take a long time. It was how the class began. We recapped from the previous week. If a student hadn't, really studied the previous week's content, it provided them with an example of a potential future item that they may have to answer. So again, it's a sample item. I have been using drag and drop in ExamSoft with 99% success. I had one student had a computer issue, but out of 100, that wasn't too bad. And so again, it serves multiple purposes doing this within the context of your classroom. So another example of items that were used that same week during class, asking and allowing students to predict what will happen next. So remember, predicting provides students to practice using information in context. They can start from their current knowledge and you can say, what's next? So these 2 examples were, again, these are formatted in Slido. Example 1 here, I'm circling example 1. My little pointer is being weird in the one in front of me. So example 1 provided students with an opportunity to just do free text. So free text ideas, engaging with their imagination. It's more relaxing. Share 1 assessment. I had just discussed the content related to assessing a patient with increasing intracranial pressure. So just free text, give me something that you would assess. So this is not specifically NGN, but just kind of led up to example number 2. That was a little bit more detailed and a little bit more difficult. So the nurse, example number 2, the nurse assesses acute changes in level of consciousness in a patient with an acute head injury. Select from the list the top 3 priority assessments to observe and document. Select all that apply. So here I am serving a couple of purposes. I am using this extended multiple response item type. I am giving them the N, the number of items, and they then got feedback about their comprehension of the content that I had just taught. And that slide was immediately followed by this slide, which provided, this is the actual slide that I used in class, and allowed them to connect the question to a next generation NCLEX item type. And with this, I shared the change in the scoring strategy. And so, of course, students are very interested to hear about the scoring. So with this item type, I said the test taker is given the number, or N, of the correct responses. The list of options may be up to 10. So that's a little nerve-wracking for students when they hear, oh my goodness, it could be as many as 10 items I have to choose from. Well, then reassuring them that this will be scored in a way that they will get points for all of their correct responses. So if the item asks for 3 correct responses and they get 2 of the 3, they would get 2 points added. If it was scored in the plus minus framework, then you would receive a -1 for the incorrect response. So just reiterating with them that there's going to be a change to scoring, that the scoring may include a plus-minus strategy, or it may include what we're calling partial credit, which would be if there were 3 correct responses, then they got 2 out of the 3 correct, they would get 2/3 of the point allocated for that item. So this has really allowed my students to sort of better understand that scoring will maybe feel different, although they won't know about the scoring, that would be in the background, but a little bit about scoring. And of course, then they follow up with the question of, well, when will the scoring change on our exams? And so for some of the items where appropriate, I have begun to give partial credit with extended multiple response. So let's say I tell them there are 5 correct responses, and if they get 3 out of the 5, I am giving them 3/5 of that point, just to begin to allow them to see how partial credit scoring will work out. All right, so the another strategy, and I did start to use this strategy in the fall because I was trying to connect with the students' affective or emotional domain by providing this slide that says, how will you use this information as a registered nurse? So activating their limbic system, helping them to engage with their future selves. And also, this allows me to practice the strategy of interleaving. So usually the content that I place after this slide is a maybe utilization of lab or diagnostic testing, integration of assessment, nursing interventions, taking the didactic information and framing it into a clinical case or framework. And again, I also too reiterate to students in class that this is a great way to study the didactic content. And that is to imagine how will the nurse use this information. And of course, the nurse uses the information in a very complex and interwoven way. And sharing with the students ways to do that in the classroom can be very beneficial. So one of the ways, of course, is to use a case study in the classroom or multiple case studies, breaking the groups up into smaller groups, and allow them to interact with the case study. Another example that I've used in a foundations course or fundamentals course is to have a patient education activity related to the content. And I have, developed millions of these. So these are very fun, taking content and actually having groups of students doing patient education about the content. And sharing it with the class, sharing, the bullets of information with the class. I have also done group concept maps. So I've pulled open a concept mapping software and working through that in the classroom environment. So fun ways to mix things up and make them more relevant, clinically relevant. All righty, so I'm going to kind of move into an assignment that we have in my course. And so when thinking about how to teach and replicate the actual work of a nurse, and to be able to really evaluate that in the form of an assignment or other learning activity is really tricky. And so this is an example of a way that we've tried to accomplish this goal. And so a little bit about this assignment that we call our case study assignment. So our case study assignment allows the students to connect and practice using information shared in the course in very authentic ways. So students are going to be making these meaningful connections between information that we have shared in the course, and they are actually going to be using even some psychomotor skills that nurses use to gather and find and utilize information. This assignment we call our case study assignment. It was a paper. So recalling that I teach pathopharmacology, this assignment was a very long paper. It was 12 to 15 pages. It involved a student being given a diagnosis and working through really the pathophysiology, nursing assessments, nursing interventions, and pharmacological medications, as well as lab and diagnostics. So it was really an extensive paper, and I have a class of 100 students. So it was a lot of work, and internal consistency was always a concern when you're grading this many papers. And so about 4 semesters ago, another duo of faculty who I've listed here, Carmen Heiss and Michelle Moulton, conceptualized a way to take this assignment and the rubric for the assignment and really the points allocated to this assignment and place it into ExamSoft. And by doing this, it of course eased the grading of this assignment, but it did require some great creativity. And so the assignment began with some basic questions and interpretation of information about the case. Oh, I'm hearing somebody. But this assignment moved to the goal of enhancing the students' readiness for next generation NCLEX. And so this semester, I sort of revised the assignment a little bit with Carmen, and we worked on it together to really enhance not only the outcomes of the assignment, which was of course the understanding of the content, but take a look at this item. So this item is in ExamSoft, and it is using a set of symptoms that there are 10, but of course I'm only showing you a selective selection of them. Students are then to look at the symptom and identify which disease is related to the symptom. In this case, peripheral artery occlusive disease, and the patient had an acute MRSA infection in the lower extremity. They were to then look at the symptom and decide based on their resources and the materials that they've read and have available to them, if the symptom is consistent with one or the other or both. And this was designed in a close drop-down table format. And again, the content is related to clinical judgment step number 3. So we're not recognizing cues, not analyzing cues, but now what is going on? Prioritizing hypothesis. So we were able to kind of thinking very carefully about this assignment using frameworks of next generation NCLEX item types and an actual step in the clinical judgment model to ask this one question in this assignment. Another activity in the same assignment, again, we had sets of diagnostic tests. So what does the nurse do in the clinical environment? A nurse takes lab and diagnostic data and may have to look something up, answer a question about its meaning. This question has the student decide which stage of chronic kidney disease is this patient in based on laboratory value. So again, this is using hotspot technology. So this is kind of what the item looks like from the back, from our view. We have the highlighted correct area there indicated in our view. Of course, the student doesn't see that. The student uses hotspot technology. The student is analyzing the cues of the laboratory data and coming to a conclusion about those clues. And this is really what nurses do, right? Nurses really do take lab values and they look up information and they try to make connections between what they are seeing and what it means for that patient. Our students are using their textbooks, they're using Lippincott Advisor, and we are not allowing them to use the internet as resources for this assignment because, of course, you can find anything you want to on the internet. There's another similar question that we used this hotspot technology with all 4 of the medications that are in this case. The medications, the students have to select the indication for the medication from the Lippincott Advisor information about indications for the medication. The students have to decide if they're going to administer or hold the medication based on the information in the case. So this is really meant to replicate the processes that nurses engage in every single day, while in the background accomplishing our goals of using technology that is similar to the next generation NCLEX processes. And in this example, these are hotspot questions. So allows the students to do that psychomotor skill of aligning that pin with the correct response. I do think I see a question in the chat box, so I thought I would take a breath and see if there were questions. I'm gonna see if I can pop open. All right, so what do you do when you try to engage students and ask questions about clinical and you get silence? Well, you know, certainly I've been there and had that happen. I think for me, I have a big class, so it doesn't happen very often. I have a class of 100. Now, my class is recorded, you know, like it or not. So my attendance is usually about half. So 50 to 60 students will come. So I have a really big N. And so I don't often have silence. I would say I would tell a story. I would have my own example kind of ready to go if it was really quiet, if you really got crickets. I might call on a student if they were sitting up front, for example. Those tend to be students who are more comfortable with engagement. I certainly wouldn't call on anybody that was in the back row. But one of the students who has really good eye contact, I'm just ask them a question. Have you cared for a patient who had a creatinine that was abnormal? The other thing is when you ask for a story, you might want to simplify it a little bit and kind of drill down. Well, maybe they haven't had someone who had end-stage renal disease. Have you ever had a patient who had an abnormal BUN and creatinine? Something simpler, something a little bit more direct. But I always have lots of stories. I was a med-surg nurse for 17 years, so don't ever not have stories to tell. So ideas about the practice of self-explaining or the strategy of self-explaining. Well, these kind of all fall under the clinical judgment step of taking action. So nurses do a lot of teaching. So obviously, patient education is a great way to check your own knowledge, practice the strategies, and maybe even talk about assessment prior to patient education, right? What do I want to assess prior to engaging in patient education with my patient? But in the classroom, I have had content that I found to be extremely dry. And we all have it, right? And for me, it was hematology. You know, this type of anemia, that type of anemia, this type of anemia. I mean, there's just not a lot you can do with that. So I decided, I was actually working with a graduate student, and I decided that I would like to change this up quite a bit and have the students, have a basic PowerPoint outline of the content. And then when they come into the class and they don't know that this is happening, right? But just give them a forewarning that, this week we're going to do some active learning. Please review the outline. And then I had 5 patient scenarios written up, one for each of the main hematological abnormalities that were being featured in the class, broke them up into 5 groups, had them read the case, and interact with the family member or the patient as appropriate. This went over amazingly well. I gave the students about 45 minutes to kind of work on understanding their disease, work up their little education. This had to be done using the language that a patient would use, so no medical terminology. And this allows students to do this self-explaining, to practice the action of patient education. What am I going to do? What am I going to teach? What are the priority facts? And really does buy into step 5 of the NGN model. So how will we, in the classroom, allow students to have practice with action-oriented nursing intervention? So patient education is definitely one way. Another way is role playing. And so role playing with partners, kind of the think, pair, share model, where you partner up with someone and one is the nurse and one is the patient. And we are going to review this group of medications that we are going to be administering. I'm the nurse and I'm going to interact with you, and you are the patient and you are going to ask me questions. And I really encourage the students to do this activity. It really helps them to understand and be in touch with their knowledge gaps and what they know and what they don't know. So again, we're fulfilling multiple objectives by bringing these activities into the classroom. And then, of course, teaching basic nursing skills is something I wanted to just spend a minute talking about. This is sort of a favorite topic of mine, 15 years of teaching fundamentals. So this isn't really a traditional didactic classroom, but it is the skills classroom, right? So many of us teach the background content of nursing, basic nursing skills in a more formal classroom environment. And it might even be in the skills lab, but you're teaching it in a more formal classroom teaching modality. Remembering that when we teach basic nursing skills, first semester students, we have to frame that skill in a real patient. How do we do this? These are fundamental students. Number one, we can frame our real patient using an electronic health record like DocuCare. And so that is what I did. Every skill was related to a patient. Sometimes actually several skills were related to the same patient, which really helped with the students kind of getting going on the skill, right? So if it was a really time-intensive skill, I would use one of the patients that I had already presented, and they would then modify the skill related to that patient. So when our students need to practice how to take action, clinical judgment, step 5, they need to understand that in this basic skills lab, this skill is going to require modification for 9 out of 10 patients. And how do we do that? We provide that knowledge within the context of a real scenario. Students will have to look things up. You may provide some lab information, some definitions. I provided what I called guiding questions, which kind of directed the student to look things up so that they were really understanding what I was getting to. Rationales are shared. I always call those my pearls of wisdom. The rationales is right where the gold is, right? So having the students understand why we were modifying this skill in this way, what is the rationale? So I did just want to, I know that's not a traditional classroom, but I did want to share that the teaching of basic nursing skills, I believe, should always be in the context of a real patient, and that always should need to be modified, because that is where the learning takes place, not reading a basic skill out of a book. And so here, kind of towards the end of my formal comments, how I am using classroom technology to enhance the development of clinical judgment and to enhance my students' ability to understand the psychomotor dynamics of answering these next generation NCLEX and practice answering these questions. So one I've shown you is the Slido audience response software that we use. In the past, we have used Poll Everywhere, and these are both anonymous. Students are responding. It gives you a number of respondents, but it doesn't tell you who. And I've really enjoyed using Slido. It was a really quick learning curve. It wasn't difficult at all. Getting logged in is, a little bit of a challenge at times, but just getting everything synced with your PowerPoint and all. And then the other idea to remembering in the classroom to deliver short quizzes. So in your Blackboard or in your Exam Master, in your exam software, however you deliver, using short quizzes, whether they're 4 points or not, just to generate your students' knowledge, to help them to reflect on what they have learned at the end of the class. Doing questions and answers. I have the discussion board. Some of the faculty here use the discussion board for weekly practice questions. And usually they're harder questions, right? Generating, a lot of conversation and a lot of discussion. During class, you can do what's called a 5-minute paper. It's a recall activity. I really promote practice with recall with the students right now, especially coming out of COVID. Again, I feel like the students have really kind of gotten lost that skill a little bit with the open book tests and open notes test. I actually had a student who told me all I really learned in the last 2 years was how to take really good notes. So doing some recall, working in pairs and small teams, really engaging with the affective domain, providing, for me, I provide a lot of videos of medical providers examining patients with the disorders that I'm teaching about. I find that to be really effective. They're real patients, real medical providers, and the students are able, for chronic neuro, for example, they're able to see someone with Parkinson's disease being examined. So, wow, what a powerful way to use technology to engage with your students and to enhance the learning environment. And so we're at the end of my formal comments here. Of course, I never know how long these are going to take to deliver, and I'd rather be under than over. And so using these evidence-based practice teaching strategies described in this book, Small Teaching, I'm hoping that this will result in the development of long-term memory and increased classroom engagements. All of these activities are engagement activities. And that also then kind of layering over these additional goals that we have to focus on clinical judgment, helping students to become oriented to the next generation NCLEX item types and the cognitive approaches to answer them successfully, increasing their confidence. And using the terminology when designing our lecture level objectives, class discussions, presentations, assignments, demystifying these new next generation NCLEX item types, and really just helping your students to feel more comfortable with them. And the more comfortable you are, the more comfortable they will be. Just like our students, we need to practice using these languages. It did not come easy, right, at the beginning, but it gets easier as I practice and as I use this terminology. And so I want to just open it up for questions. I'm going to stop sharing my PowerPoint and see if we have any questions in the chat box, or if you would just like to unmute yourself. If you raise your hand, and we do have a little audience response indicator that you can use to raise your hand, that would be great. And happy to hear what you're doing in your classroom that you have found to be successful. Maybe some ideas that we haven't really tried yet. And honestly, this was my first semester really layering on the goal of NGN item type orientation to the students and applying it into my classroom on an almost weekly basis. I have skipped 1 or 2 weeks where I just did not have the time to add that element. But of course, they all say, where are the exam type questions? You know, I get a lot of feedback and motivation to do this work. So if I'm not seeing any questions, if there were any, oh, let's see, I see a few things popping up. So someone is asking about using concept mapping and making connections outside of the classroom. So I have one student in this class of 100. So this is a great story. I have one student who met with me the second week of class. So I call him the concept map guru. He had this great idea to use a sketch pad. And as I am teaching, and even after, he begins to conceptualize his concept map. So of course, this is a student where concept maps really resonate with him, right? He's a visual learner and he likes the process of drawing and reorganizing information. And so this student met with me the second week of class, showed me the concept map he made for the first week of class. Front page is PathoPharm. The back was the MedSurg content for one disease process, a key disease process that we had discussed. So I gave him some feedback about a couple of tips and tricks to kind of make this a little bit stronger. Also to add, whenever there are two similar disease processes, to add like a Venn diagram or a table where he puts, you know, how are they alike? How are they different? Doing that compare and contrast, which is so important, differentiating two similar disease processes, which was week 2. So osteoarthritis and rheumatoid arthritis were the two that I had him work up. So since then, this student has really become the go-to. I have had other students who are reaching out to me about study strategies. And I would say, you know, I love using concept maps. Personally, I'm a very visual learner. And so it resonates with me. And I am a puzzle person. So I really love this process of realigning content in a new way. But in my course, I don't do anything formally. I do know that some other courses do use concept mapping and also care planning. But I love concept mapping. And in my former job where I did teach MedSurg, I would pull up a concept mapping website right in class, and we did it together. And that was really engaging. It's really, for me, it was a fun process. And I saved it, and then I just emailed it to all the students. So everybody got this one concept map that we did together. So reading assignments are very difficult. I will say, students have said to me, by including that question at the beginning, 1 or 2 questions, this week I had 2, about last week's content or this week's content, they really said this reaching back and looking forward. So what I did this week to do something a little different, I had one question that related to last week's content and one question that related to this week's content, looking forward, kind of a predicting question. And it had to do with assessment and renal function. And I gave them a little lead in about, the importance of the kidneys and filtering and creating urine. And so then what did they think would be key physical assessments that I will be focusing on for all disorders that have to do with the renal system? Then the next question, so that was one question. And then the next, so I had 3 kind of interactive activities at the beginning of class today, or this week, yesterday. Students really felt engaged. Another thing I did, and I didn't include it in this presentation because I just did it yesterday. I actually did it on Sunday because I was teaching about renal. And the way I teach it is pre-renal, intra-renal, post-renal, so I have a framework for describing the disorders. I created a matrix in a table in my PowerPoint, and I had symptoms of renal disorders. So not the names of the disorders, but this time this like a key symptom of the disorder. Could be a lab value, could be a urine characteristic, whatever. And then they had to pick which categorization, pre, intra, or post. Now, I know that that's really a knowledge level question, and my course does rely on a lot of knowledge level content, right? So pathophysiology, lots of knowledge level. I don't teach the med-surg course, that's on Tuesday, but it allowed them to see this matrix. I gave them the direction, 1 correct answer per row. And I had them work together on it. So again, it was like 3 minutes. It didn't take a lot of time, but it really did help them to engage. And in a class of 50, 60 students, that's a struggle in and of itself. So I just, want to, oh gosh, so I have another little chat here. Considered sending students at the end of the class just to keep them and let's see, here's the question. This was a great presentation. Have you ever considered testing students at the end of class? Oh, absolutely. So at the end of class, that's another time to place a little mini Quizlet. Absolutely. So what did you learn? And this keying them into the key concepts that are what they are to learn. The only fair way to do that, honestly, is to give them sample test questions, right? They need practice. They need to see how hard are the questions going to be. So not fair to not let them into what you're thinking. If you've taught about heart failure, they need to know about the symptoms. They need to know the difference between right and left. They need to know, right, the lab that they're going to monitor. So I'm not telling them what their exam questions are going to be because, of course, there's plenty of things to ask them about, but to give them an idea to practice the difficulty level of the test question, the only fair thing to do. And of course, I have that little thing in my head that NGN, I want them to see this matrix. That was my idea for the table so that they can see that. And I did say after that, some of these matrix questions will say there's more than 1 correct response per row. So I am trying to just demystify the process for the students while engaging and creating long-term memory. It's a tall order for us all, but I'll tell you what, enhancing my own classroom teaching materials is something that I've always done. It's a practice, and it's what makes the job fun for me. So this is the fun part, the not so fun part, right? There's lots of those too, but this is one of the fun parts. So, all righty. Any more questions or comments? Really appreciate your attention and your engagement. And I hope that I have provided you with some ideas changing that paper into that assignment was really the brainchild of Carmen Heiss and Michelle Moulton, but this semester we really took it to a new level. And I hope you enjoyed it. So great to see you. And Sonia, I do believe we're done.
Thank you.
All right. Thank you for helping me moderate this. Appreciate that.